I didn't know what I was going into at all, but I found it really, really rewarding. It was a really good experience.
It was really good to learn about how all the different health professionals work together as a team to provide a great service.
This hands-on experience helped my learning because I was able to better understand the patient journey through out-of-hours care.
It was really interesting. It's something I've not done much of before in the university, so it's interesting to get a hands-on experience of what it's like to work in the GP practice as a pharmacist.
Learning about care of paediatrics, who are a diverse patient group with unique needs. Patients on the ward range from 3-week-old babies to 16-year-old adolescents, and I got lots of practice of weight-based dose calculations.
And so being able to listen to the live calls from the call handlers and clinicians and listen to how they triage, it was a really valuable experience.
Completing polypharmacy reviews with the pharmacist, going through patients' care summaries and making decisions about where we could change the medicines to make it more cost effective and effective for the patient's health.
We did a lot of care plans, so that was really good in putting our current modules into practice and was really good for my uni work I'm doing just now.
I really enjoyed seeing how a pharmacist fits within the multidisciplinary team.
I most enjoyed being part of the pharmacy team, which was also part of a larger multidisciplinary team of doctors and nurses all working together. Everyone was really friendly and really welcoming.
Being able to be out in the hospital environment, on the wards, working with lots of different healthcare professionals was really good, and it was good to see the role of the pharmacist and how that integrated into the team. And I really got the opportunity to get right in as part of that team, watch everybody work together, see how the doctors, the nurses, physios and the OTs on the ward all came together to provide the best care for the patient alongside the pharmacist.
Prepare some questions because you're getting to meet so many health professionals with all the experience they have. They'll be able to answer your question without a doubt, so just think of plenty of questions to ask.
Take on as much as you can and just try and get involved as much as you can when you're there.
If you're going out on placement, I think the best thing to do is just get stuck in and ask any questions you have because everyone's so friendly and supportive.